Should I have surgery for my asymmetric eyelids?
Cosmetic upper eyelid surgery is often requested by people who feel they have asymmetric upper eyelids. Causes for asymmetry can include differences in bone structure, the amount of skin and fat over the eyes, the eyelid height, and the appearance of the eyelid crease. I'll discuss how I evaluate patients concerned about asymmetric eyes in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As a specialist in eyelid surgery, I perform all types of eyelid cosmetic and reconstructive surgeries every day in my practice, including revision surgery to correct cosmetic eyelid surgery procedures originally performed by other doctors. I also perform non-surgical eyelid procedures every day, including fillers, Botox, PRP, lasers, and radiofrequency technology treatments. Some people notice that their upper eyelids are slightly different in height and express concern. Oftentimes, this is something only they are aware of and is not something that other people notice. I explained that it is normal to have a 1 to 2 millimeter difference in the height of the eyelids. Generally, unless there is a more than 2 millimeter difference in height between the two eyelids, most people looking at you don't notice anything. If the eyelid height difference is within this normal range, surgery is usually not recommended. If there is a greater than 2 millimeter difference between the eyes, one eye may be too low or too high. Of course, there are conditions where both eyes are too low or too high, or a combination where one eye is too high and the other eye is too low. When the eyelid is lower than it should be, the term to describe this condition is eyelid ptosis. Eyelid ptosis refers to two types of conditions: congenital ptosis, which means ptosis you were born with, and acquired ptosis, which is ptosis that occurs after you are born. When a significant amount of acquired ptosis occurs, a proper ophthalmologic and neurologic examination may be necessary to rule out a neurologic cause for the ptosis. When surgical correction of ptosis is being considered, the type of surgery I perform is based on the degree of ptosis and the strength and function of the levator muscle, which is the muscle responsible for most of the upward movement of the eyelids. I routinely perform procedures to treat mild to moderate ptosis from the underside of the eyelid by shortening a muscle called Mueller's muscle. I also perform surgery such as levator muscle advancement, which is done from the front of the eyelid through the upper eyelid crease. In select situations, such as congenital ptosis with minimal to no levator muscle function, I perform a procedure called a frontalis sling, where I create a connection between the eyelid and the muscle above the eyebrows called the frontalis muscle. This allows for the action of raising the eyebrow to open the eyelid. Another variable which is not typically thought of as contributing to asymmetry is bone structure. If you look at both halves of your face, you'll notice that the face is not perfectly symmetrical. Even celebrities and models who are known for their symmetrical features do not have perfectly symmetrical faces. The cheekbones can be appreciated as being different in terms of projection when one side of the face is compared to the other. Bone structure determines eye shape as well as the relationship of the eyebrows to the eyes. There are times when this variable is not fully appreciated when a surgeon performs upper eyelid surgery, which can result in upper eyelids looking hollow. I often address this situation by placement of a long-lasting hyaluronic acid filler at the bone level to restore fullness in a way that looks more natural and symmetric. The same applies when no prior surgery is performed, but the upper eyelid area appears asymmetrically hollow because of genetics or aging. The upper eyelid skin can also look asymmetric between the two eyes in several ways, such as the amount of hooding and the relative amount of fullness. In Asian eyelid anatomy, one eyelid can have multiple creases while the other has one or no crease. These situations are typically managed with cosmetic upper eyelid surgery or upper eyelid blepharoplasty. I approach these situations with a customized strategy which is specific to the individual's anatomy. For example, the amount of skin and fat contouring I would perform would be different between the two eyes. In a situation such as where multiple creases in an Asian eyelid are present, I would consider performing a procedure such as a non-incisional Asian eyelid surgery to create a more stable and symmetric eyelid crease. Filler placement is routinely performed in my exam rooms with blunt cannulas resulting in minimal to no bruising and minimal swelling. I perform upper eyelid surgeries such as upper eyelid blepharoplasty and ptosis surgery and frontalis sling using local anesthesia with light intravenous sedation. In some ptosis surgery procedures, I have my patients sit up so I can assess the eyelid height and shape with the patient in a natural and upright position. This approach has been easier for the patient as they avoid the nausea and the opioid drugs used, which are more associated with general anesthesia. Our patients usually return to work in about a week when the surgery is performed. Before deciding if upper eyelid surgery is appropriate for your concern about symmetry, it's important to differentiate natural and subtle asymmetry from significant asymmetry. When surgery or non-surgical options are to be undertaken, the surgeon's experience and aesthetic style is critical to achieve natural-looking results. Eyelid surgery, particularly for the purpose of achieving maximal symmetry, is very precise, to the point that millimeters really matter. I hope you found this information helpful. Thank you for your question.